There are 6 elements in the PRISMA project. Information system is one of them, but there is also the implementation of coordination table where all the policymakers and the manager of all organizations involved in care for the elderly are coming together to set up the system, a single entry point, a case manager, an individualized service plan that is completed by the case manager after the assessment of the client, and also common assessment instrument, the SMAF, and a common management system based on the SMAF, which is a disability assessment rating scale, and finally the information system. So all this constitute the PRISMA experiment, and it was running for 4 years with the 2 implementation study at midterm and a final implementation study, and also an impact study on a cohort of 1,500 people over 75 followed for 4 years. And so we showed that it improves the satisfaction of people, the empowerment of people, it decreased the functional decline process, and it reduced the emergency room and hospitalization for the experimental group. All this without extra cost. So with the same amount of money, we improve the efficacy of the healthcare system and also the satisfaction of the clients. There was 2 experiments in Quebec to get some evidence-based data on integration. The other project was SIPA in Montreal. SIPA is a full integration system. It means that a single organization is caring for a given population, and they are providing home care services, they are providing also medical evaluation and nursing evaluation, and they are contracting with different organizations in the area. That's different from PRISMA, which is a system change. It means that all organizations in a given area are part of the PRISMA system. So it's not run in parallel with the usual healthcare system. So those 2 experiments were run in Quebec. The problem with SIPA was that it's a good model for countries where there is a strong private system, but for a publicly funded universal system, as in Canada, it has some disadvantages because it's run in parallel with the usual healthcare system. So the PRISMA model is probably more appropriate for our healthcare system because it introduces in the system a systemic modification of the organization. And so far in the literature, when you look at the literature, only the full integration systems has been evaluated with randomized control trial because it's easy to run. It's easy. Yes. It's easiest to run a randomized control system on those kind of system. With a coordination type system like PRISMA, it's much more difficult because all the area are changing. So you cannot run a randomized control trial. You have to use a quasi-experimental design, and so it's more difficult to prove the impact of those kind of system. And it's the first time in the literature that the coordination type system has been demonstrated as efficacious. I think it's interesting because it gives evidence base for another model of integration.